Some of the good things to keep in mind about communication is really being in the room with your patient, really listening. And I know that can be quite difficult for some specialties these days, especially with mandated reporting on computers and such. But it is so important, especially for teenagers, if they're going to follow through with listening to you and listening to your recommendations, to just make them feel heard. But of course, this is all populations as well. And another thing is with catastrophizing, that's a big hot topic that's been going on lately. And so a good communication is if a patient says, "Oh my goodness, I feel like I was going to die when I had that pain episode," instead of just automatically assuming that, oh, that was an over-exaggeration, let's just move on. Take the time to really understand why the person was saying that and understand where they were coming from. And those sort of things allow beautiful communication between the patient and the provider. And the patient is then more likely to be able to follow your recommendations if they feel heard and understood. Another very important component that oftentimes is missed is good self-care for the health professional themselves. So in between sessions, working with pain patients is a very difficult thing. So making sure to do your own breathing before each session and taking care of yourself so that you're able to model that within session is something that's very important and healthy as well. Where do I begin? There's so many. There's a few just don'ts, as I call it, that I have throughout my workshop on this topic. And a couple of the don'ts are just anything related to, oh, you look so good. You're so youthful. You don't look like anything's wrong with you. I can't believe you're in pain. You're so young. Those sort of things. And that's more for the younger populations and the stigmas of invisible disabilities. I myself have chronic pain and spinal injury and several disabilities, and from looking at me, no one can tell. And so I've experienced several of those comments myself, and it's quite invalidating. So those are some of the bigger ones of not commenting on how you look. Another one that's often missed, but that many chronic pain patients talk about, is just the question, how are you? That is something in the chronic pain world that is so difficult to answer because the person has to decide, do I really say how I'm doing? Do I just say okay and fine because that's what is expected of me? Or do I make up some other lie about it? There's all these things that rush into the person's head of what to say. So I say that the better question as a healthcare provider to ask is, how have you been since the last time we've seen each other? Or what things have you been doing to take care of yourself? Or things like that, not how are you today? And it's also a good kind of form to get with just people in general. In psychological sessions with my clients, on the other hand, I teach them how to respond to those questions because, of course, that is a typical question in our society, how are you doing? So I really allow them to make the choice of, is this someone you can trust, who you can say, oh, I'm not doing so well, I'm in a lot of pain today? Is this someone who you can say, oh, I'm just fine, and move along with it and accept that that's okay too? How can you not be so triggered by that question? So that's some of the work I do. This topic is just near and dear to my heart, not only because I'm a pain patient and I've had several of these experiences, but it's just all around a fun, kind of fun thing to talk about because it just reminds us that we're human. It's about recognizing when we're saying these things, apologizing if it's offensive, and then learning from that. And you know, it's not necessarily we have to be on tiptoes around our patients. That's not it. It's about really facilitating genuine communication and understanding what are the needs that I can give my pain patients and how can we connect more in a way that benefits them on a biopsychosocial spiritual level as well.